Hey everybody, welcome to another edition of Muck Rack Live. I'm Greg Galant. I'm the co-founder and CEO of Muck Rack, and I'm so excited that you've all taken some time out of your day to join us here today. We've got a really great lineup for you today. We decided it'd be fascinating to hear from the people in the PR community who've had the biggest challenge this year, people who are in healthcare PR, where of course with the pandemic, there were demands made of them unlike anyone else. We have a lot of customers here at Muck Rack that are in healthcare and use Muck Rack to do communications for healthcare. And we saw, firsthand from working with them and supporting them, what a challenge they had back in February, March. I mean, we all had a big challenge this year through the pandemic, but no one more than healthcare PR. So with that, I would love to introduce the panel. We have three great people joining us today: Marvin Stockwell, Matthew Libassi, and Jenny Nowatsky. And with that, I'd like to invite them each to introduce themselves. Marvin, why don't you go first?
Sure, happy to. Glad to be here. Thanks for having me. My name is Marvin Stockwell. I'm the Director of Media Relations at St. Jude Children's Research Hospital in Memphis, and it has been quite the professional transit as the whole world has adapted and learned to do things in different ways. But our industry, broadly speaking, certainly has had to adapt and change. But I think that's a strength of PR.
Great. And Jenny, you're up next.
Hi, my name is Jenny Nowatsky. I'm a senior media relations specialist at Northwestern Medicine here in Chicago. My background, I was in TV news before I made the leap to PR. And before coming to Chicago, I worked for Nebraska Medicine in Omaha, where we cared for Ebola patients during the Ebola outbreak. So I'm going from Ebola to COVID. So it'll be interesting to see the next job I have, what sort of pandemic we end up with. So thanks for having me.
Your Twitter bio, Ebola to COVID.
Exactly.
And Matthew.
Sure. Thank you. Thanks, Greg. Thanks, everyone, and giving me a reason to actually comb my hair today. So much appreciated with that. My name is Matthew Libassi. I am a senior media specialist over here with Northwell Health, specifically with the Feinstein Institutes for Medical Research, which is the science arm of Northwell. Northwell Health is the largest health system in New York, and we have our own science research arm. Prior to joining Northwell just a little over a year ago, so I'm fairly new to the Northwell team, I was with Ketchum PR. And prior to that, for 10 years, I was a reporter and producer with Fox News and Fox Business. So I made that jump just a few years ago, and an interesting ride it certainly has been recently. So
great. Thanks again for everybody for joining us. And we just want to start off with this question. Going back in time, I mean, things have been evolving so much, it's almost hard to remember, or in a way, it almost feels like I'm asking you to recall something from years ago. But let's just go back to February or March of this year, when COVID was just causing, everything to shut down, hospitals to overflow, and what were your lives like then, and how did you pivot, and what would your organizations have to go through to communicate and get the message out?
I would just say that, so in February, I actually had a St. Jude business trip to Seattle, and we were starting to get the first inklings that this was, it was coming to my personal awareness mid-February, and I did see some people wearing masks out in Seattle. And then right about the time my colleague and I got home to Memphis and we started reading the news, we're all of a sudden it started hitting us, how serious this was. But, we had to set all sorts of work aside. I was planning to have Dr. James Downing, our CEO, go to New York for a series of desk side briefings and some media engagement. Completely canceled. I had conferences that I was going to go to, and we had to set all of that aside, as we all did. But then I think we had to take a step back and say, the kind of classic crisis PR question is, what would a reasonable person expect a responsible organization to do in this situation? And I think that has to, but that's thought of with the kind of traditional crisis in mind, where it's a particular organization's crisis. But of course, this is the world's crisis, and we all have a role in it. So I still think that framing question for PR people is valuable, but I think we have to adapt that and say, how would a reasonable person expect an organization like mine to conduct itself in this pandemic, and how can we be helpful? And in answering that question to be helpful, we have to take long enough to think through how can we authentically answer that question. And I think some brands got a little bit in trouble because they probably asked the question, what should we say? And that can lead you to kind of just jump something out there really quick. St. Jude pumped the brakes, and we really took stock of what we not only could say that was helpful, but what we could do that was helpful. And I can get into some of the specifics organizationally, perhaps a little bit later, but it really did. The pause was really only about a week to 10 days, so where we could really say, how can we be of best service to the world?
Great, thank you. Jenny.
Sure. I would say we jumped.
Maybe you could also contrast it, with your Ebola experience too. It'd be fascinating to hear both.
Yeah, I was just going to say, so when Chicago's mayor put the stay-at-home order in place, that's really when we jumped into high gear. And immediately I called my boss and I said, look, the number one thing that we did when Ebola hit that worked the best for us was that we identified key members on the PR team to handle the media requests that were coming in. And then that person could, shuffle out the request to different physicians or bring in other people to help. But it really did help having a funnel, like a main person to take on all the requests. Because at the beginning, physicians were getting media requests left and right, and they didn't know who was who and who they should trust. Yeah. So the first thing we did was establish 3 key members of our team to take on all of the COVID requests. We updated our website at the very top saying, if you have a COVID request, please contact these 3 people. Our media relations hotline, we now have forwarded directly to myself and my colleague, Megan. So we swap off every other week, just taking the media relations hotline because the majority of the phone calls coming in are all COVID related. The other thing that we did right away was establish physicians who we knew had the time and the expertise to take on especially national level media requests. When you have NBC National asking you, how many patients are on your ICU right now, and do you have enough PPE, and are you worried, about staffing, you have to have physicians who can answer those questions in the appropriate way that your hospital leadership won't be, calling you right away saying, why is that physician saying that? And then the other thing was starting to do Zoom interviews. This is brand new for us. Before COVID, anytime a reporter wanted an interview with a physician, we were bringing them inside the hospital and setting up the gear and the lights and the microphones. And now it was, training physicians on how to do Zoom interviews and making sure that they had ring lights and microphones. And even like this Northwestern Medicine sign behind me, we purchased those for our main physicians to make sure they were in the background, making sure they're wearing their white coats. Another thing that we also did at the very beginning, because media wasn't allowed inside the hospital. And so in order to tell a story, you needed the visual elements. And so we had to teach our nurses and our physicians how to shoot video, with their phone, holding it horizontally, getting wide shots, medium shots, tight shots, making sure each shot was at least 10 seconds long. And then they were sending all the videos back to myself. And because of my TV background, I was able to edit together a quick little B-roll for the media outlets and send it to them. Another thing we started at the very beginning was doing video diaries with a lot of our physicians and frontline workers. And NBC News now, they still are asking us almost every week, like, what new video diaries do you have? Do you have anything for us? And they can easily be shown on, MSNBC, NBC, the Today Show. And then we also utilize that and put it on our Twitter page, our media relations Twitter page. And then our hospital Instagram account, they're also now using the video diaries to use. So we've had to think outside the box. And a lot of it is just shooting our own stuff. And that's how we've been really successful on a local and national level.
That's great. I definitely want to ask more about how you train nurses and doctors in a moment. But first, Matthew, tell me about your experience.
Sure.
Northwell, such big coverage here in the New York area.
Sure. Yeah. I think to echo everyone, I think it just happened so quickly. I think all of a sudden, we were hearing news reports coming out. We weren't really sure. We were still in the office up into that mid-February time, and then all of a sudden, it just seemed to kind of hit all of a sudden one weekend. So I think the word that I like to use for Northwell Health and Feinstein Institutes and everyone is transparency, both internally and externally. So from internally, they immediately set up, the leadership team immediately set up a command center. So there was one representative from every department, from procurement to PR to you name it, we were there to kind of just sit, gather, be together, and kind of understand what was happening. So the initial flow that came in was, let's just get some information out there, accurate, factual, real information out. So there was a rush for op-eds and byline pieces. Our internal team, to keep our 74,000 employees up to date, set up text lines and email blasts that they were going to set up. And then from an external standpoint, and we still to this day, transparency through and through. So if you wanted to know patient numbers, we gave it to you. If you wanted to speak with our CEO, Michael Dowling, or Dr. Kevin Tracy, you got it. So and that culture kind of is there now and continues through. So a doctor won't look at you sideways and say, "Why are you calling me? I can't do this right now." If they can't, but they're up for the task. So if media was calling, and all of us, I think, had such success from a PR standpoint, whether it was New York Times, Wall Street Journal, or who knows what, all in one day. It was that understanding that we were in this together and we were moving quickly. So it was the same kind of similar to Jennifer, where we identified some key doctors from key areas, infectious disease doctors. This is their year to shine. To our researchers who can talk about the science behind it, to our leadership team, and even our internal folks and everything. So it was an all hands on deck, all move quickly, all communicate clearly, transparently, to try and sing off that one hymnal, sing off the same hymnal going forward. So
great. And
yep,
sounds like you've all been through the same battles. One thread I picked up in all of your stories is this need to work with doctors to be spokespeople, or even train nurses to shoot and create video. So, what I'd love to hear, and I'm sure other people, even outside of healthcare, can relate because they need to use their executives and people outside of their PR team to create content. But what are your tips for how do you get these people who went to medical school? I know a lot of people talk about, how doctors feel very confident about their ability and everything because they're highly trained in medicine. Yet, they've never been, most of them weren't taught in medical school how to speak to the press, and nurses aren't taught how to use the camera. How do you train them? What are the challenges and how do you overcome it?
I think the first step is to kind of quickly sort who are going to be your mostly, you have your faculty who are eager to do it. You have some are more adept at it and better at it. So I think you have to quickly triage who your bench is. And he's absolutely right. This is definitely infectious diseases year to shine. And before I went to work for St. Jude, I didn't realize how deep of a bench of infectious diseases experts St. Jude does have, and it's really fortunate because and we through the flu season we would often get a certain amount of coverage. So I knew a good bit of the infectious diseases people, but gosh. We have a deep bench, and then our St. Jude Global Office has their own infectious diseases sub-team. So we're really loaded for bear. So it's really, you have to figure out who's the best. And then within, it's not like, oh, they need an infectious diseases expert. They're all the same. There's subspecialties within. So you've got to figure out which ones are the clinicians that are really have good patient stories. You need to have the researchers, and then within the science, and there has been, I should say this, there has been an elevated interest in science and like getting into the weeds of science, because here's this thing that's bedeviling the planet, and we've got to figure it out. So I think Joe and Jane, everybody reading or watching, more consumer focused news or top tier consumer media, just the level of science that I used to only see in trade publications, really getting into the weeds of cytokine storms and all this stuff, was really in the trades. And now you're seeing that stuff in the consumer press. And I just think it's because people are fascinated with science. So from the St. Jude perspective, we have just been overrun with media opportunities almost without proactively pitching. It's just been a matter of triaging them, figuring out who is the expert in which particular piece of the given science, and then just carving it up as best you can. And obviously, right? And coaching them, the ones who will let you coach them.
Going to the doctors, I think a little bit was being able to communicate with them separately and say, how are you feeling? Obviously at the height of this in March and April and May, to ask them to pull out of a room and do an interview just may not be possible. And we noticed a few times that we might have been using the same people. So our PR team tried to come up with a way to list out who we were using, what time, a schedule of sort of what we were booking. And we can see that if we use Dr. X one too many times, we got to give a break for them. And I just think having that side conversation with them as well, to say, how are you feeling really? Can you handle it? Can we go to someone else? Who do you suggest we could go to separately if you can't make this interview? And then going from there. And then I joke, it's kind of like collecting baseball cards. I'm actually now starting to meet some of these doctors face to face as we're going back to the hospitals with some filming and interviewing. And it says, I've been talking to you all pandemic. We've been texting, we've been emailing. It's finally good to put a face to a name. So you look to them to also suggest who from their team could also handle some of the requests, and then some of them just give proper feedback. In a sense, your doctors are your talent, and a lot of them look for the feedback. How did I do? What could I do better? And they take it and they run with it, which is great. And oftentimes I would do a little dry run, especially if it was breaking down what cytokine storms are. I would ask them to explain it to me a little bit. Break it to me like I'm a kindergartner. It's the classic line, right? Explain to me like I'm a kindergartner, and we'll do a bit of a dry run. And I usually try to staff interviews if we can to kind of help with it, but it was just too much. We couldn't necessarily do that. So I would always check in afterwards with our doctors and make sure that they felt good and nothing seemed off, and go from there.
I would say we've had the most luck with our physicians and nurses in the COVID ICU, because they are pulmonary critical care, and ICU goes, I think, hand in hand with reporters. We're running everything is now. You're dealing with high stressful situations. People are coming at you with difficult questions, whether you're in the ICU or you're a reporter. So I think pulmonary and critical care physicians are hands down the best for COVID interviews. And you asked how we were able to get our staff to take video. Well, think about your nurses in the COVID ICU. What's like the average age for these nurses? Most of them are in their early 20s. Like, they've grown up taking videos on their phones. So literally all it was me sending a little cheat sheet of just, things I was looking for and things to have them avoid. And they were texting them back to me right away. It also helps, and you guys know this from working in healthcare, just, having a great relationship with your nurse managers. Your nurse managers can make almost anything happen if you have a great relationship with them. And we have been extremely, extremely lucky with our nurse managers. They are willing to help with whatever. So I definitely, the COVID ICU has my heart, and they're a great group to work with.
That's a great point, that you have this kind of whole generation now of employees who've grown up shooting video and just finding them and empowering them, and like you said, bridging the gap to them. It's probably something that can apply for any industry.
Yep. So it's good video too. So I'm really impressed, especially like the iPhone now. It takes better video than some really good cameras too. So. That's been good.
Awesome. And How have you had to do any? I mean, Marvin mentioned, pretty much everything's coming to you. Have you all been? How have you been handling kind of your reactive versus proactive? Are you all just so bombarded inbound you don't do any outbound now, or you're still doing both, or how do you balance that?
Oh, sure. Yeah, no, we're absolutely pitching other stuff, and if anything, in the first part of the pandemic, it was really a truly COVID news cycle, and reporters would just say, "Hey, in normal times, this would be interesting to me. I'm going to put it in a file folder. I'll get back with you after the pandemic." But for now, it needs to have a COVID focus or a connection, and that's when we really relied heavily on the pandemic-specific things that we were doing that were really relevant. So, for instance, our psychology and child life teams put together a coronavirus coloring book for kids ages 5 to 9 to work through their fears with a trusted adult. Well, that was very useful. So that was not only a useful pitch, but it was a useful resource for children and for families. And we rolled out a tween version and a teen version. Our global team stood up a global observatory registry and started tracking the data on how the virus was affecting kids with cancer across the world and connecting clinicians in real time. So lots of real organization, like St. Jude added actual value to the world, and those became the hot news items for me to go pitch. That said, the kind of constant stream was the reliance on our infectious diseases expert. But in addition to that, we still couldn't skimp on pitching all the rest. It just became a little bit harder to do, but not impossible. And then ultimately, the news cycle did relax a little bit. And so now other types of things that have nothing to do with COVID are landing. It's been an interesting roll with the punches and constant recalibration enterprise, really, just since the pandemic hit.
I would say we've had the most luck with pitching stories outside of COVID when we shoot our own video. For example, I've had luck with an ENT story, a neurology story. I just shot a story with our new epilepsy genetics clinic where I had B-roll all set and packaged to go, and sent that to a reporter and said, "Look, I have these patients, this physician. Here's all your B-roll. When do you want to do Zoom interviews?" And she's like, "Well, let's make it happen next week." Because here in Chicago, a lot of the news stations still aren't comfortable coming back inside the hospital. So if we can package everything up for them, that's a really easy pitch for them to make in their morning meetings, and you're more likely to get that story placed.
We were able to, interesting was we pivoted, especially for our local media, but of course we would invite national. We started hosting virtual press conferences. So we would traditionally do press conferences on the regular and invite the folks to come in, just couldn't do that anymore. So our first virtual press conference was when we announced initiation of 3 clinical trials for the first time. And it was successful. So we would have a link in the morning, we'd work with the tech team, and we found a local studio that was right across the hospital that we were able to put folks in. And we would treat it like a virtual press conference. We'd pipe people in through Zoom. We'd be able to send out the traditional media alerts and send the link. And we even had a phone with the text that you can text your number in or kind of write in the comments, kind of like what we're doing now. And it was pretty successful. And they keep doing that now as well. So that was a way around it. But it's still a juggling act of what's proactive versus reactive. And our researchers and scientists across our 5 institutes at Feinstein, they're not necessarily all doing COVID, and they have some really good research that is coming up. And kind of like what Marvin said, any other day, this could potentially make a CNN, from homepage, but it's just unfortunate. So we try to communicate that to our researchers and just kind of manage expectations too. But we still put our efforts behind it and send out our press releases and our pitches and just try to communicate as much as possible, COVID and non-COVID alike.
Yeah, just to piggyback off of what Matt said as far as doing the virtual press conferences. So here at Northwestern, we did the first COVID lung transplant back in June. So we were the first in the United States to do a double lung transplant on a COVID-19 survivor. And when we were putting together, the press conference details for that at the time, Media was not allowed inside the hospital because of the restrictions here in Illinois. You could only have a certain amount of people gather inside in a room. And so we had to put together a press conference outside, make sure everyone was socially distanced, everyone was wearing a mask, but then we also had a Zoom link up for reporters from all across the country, and we even had a couple international hits as well, so they could watch via Zoom with the press conference and ask their questions. So that has been really, really helpful.
Great. And before I ask my next question, I just want to invite everybody who's watching live, be it through Twitter, YouTube, Facebook, or any platform. If you want to ask a question, just use the hashtag #MuckRackLive, and we'll try to ask the panel as many of the questions as we can get to. So again, hashtag #MuckRackLive, and we'll be monitoring for all those questions, and I'll pose it to the panel as they come in. So in the meantime, I guess let's switch to optimistic news with the vaccine. How has it changed, what you've had to communicate, the press strategy, everything else? What's going on now with the with what the vaccine has done to change the communications?
No, I think we've gotten 2 or 3 emails already this morning from local and national outlets asking about vaccine distribution. To be very honest, we are in the very early stages. So we don't have a lot of information right now, unfortunately, but our doctors are extremely optimistic about what they are seeing. It's kind of a lifeline for them. It's the first bit of good news that we've gotten in a really long time for those on the front lines dealing with COVID.
Yeah, absolutely. We announced late last week a phase 3 clinical trial that St. Jude is participating in, a Johnson & Johnson clinical trial. It's not one of the 2 ones that have been discussed at that kind of like top news summary with the 90 and 95% effective rate. But it's really heady times to be participating in something like that. So like we have to conduct our own recruitment efforts within Memphis to do our part. We're one of many sites for that phase 3 clinical trial, but it's exciting. It is a relief to know that they're to see what we think may very well be a light at the end of the tunnel. It's not going to be immediate. And being able to be in touch with our virologists and other infectious diseases experts all throughout, it's been, as I've coached them through reviews and what to say and how to set the rails around, stating your experience with influenza was early on was the concern. But like in marching through that, I just personally got a really deep kind of rich information set that kind of allayed my early fears, right? Like, so they were saying by the end of the year, you can expect that we'll have some type of handle on this. And then just digesting the science that's coming out of St. Jude right now around every other aspect of this. We just like, it's been a publishing bonanza, and I think these researchers obviously had these academic papers in the pipeline all along, but they're serving a really critical time. And so to see all that come down the pike, we have 86-year-old truly unicorn virologist, Dr. Robert Webster. He's one of the who's credited with the understanding that flu comes from birds. That's how fundamental to the discipline. And to have him as a resource, he's an emeritus faculty, very active, very sharp, writing books, and it's been a great consolation for me, and it's satisfied my old reporter curiosity because I came from journalism. It's been as awful as the pandemic has been fast, both as a professional challenges that have come my way, but just an interest in science and seeing the intricacies of all of it has been fascinating. So yeah, I'm absolutely reassured, and St. Jude is proud to be, participating in a phase 3 clinical trial for COVID.
I think what's interesting with the vaccine is we have lead time. right? Like we know it's coming. We're seeing it progress. So there's a lot of stories that we're developing. How do we get the freezers? What do the freezers look like? How much do they hold? What about training staff? That's a media angle right there to see with the staff. How are we prepared in our supply chain issues? So there's a lot that you can parse out beyond the science and beyond the therapeutic of it. There's a lot to parse out with the vaccine story as a whole. And I think there's a little bit of runway time that we're seeing that, because we're just waiting for, the official results and EUAs and all that good stuff to just drop and be ready to go. So it's that prep time. So it's communicating that and going both from local and a national standpoint of what can we do and what can we get and how do we show that, and trying to line up the media for when that moment that first injection. Everyone's dying for that first injection shot. So hopefully we'll be ready to show that.
And along with thinking for the future, now is we're getting into that time of the year that we usually start thinking about, okay, how do we plan for the end of the year? And then what's our plan for next year, for 2021? I imagine after all the curveballs from the last year, planning must seem a little silly, but we all have to do it. So how are you balancing like planning for what your department needs, what your organization needs over the next year, with also knowing there are all these kind of known unknowns, like when the vaccine comes out and the next waves of COVID and all that. So how do you balance uncertainty and planning?
I mean, luckily there are some things that media is going to catch on. So like Heart Month is coming up for February. I mean, now you can twist it and put a COVID angle along with Heart Month, because COVID's affecting the heart. We're lucky here because on our media relations team, we have quite a large team. So while I'm focusing on COVID, we have several other team members who can focus on the other important issues for the hospital. So that's nice. But I think, COVID's impacting anything. So you can put a COVID twist on just about anything.
I think we're trying to get back to, so at the Feinstein Institutes with our science side, we always try to have some goals for ourselves. Let's identify the 5 or 6 rising stars within our institutes. So what does that mean? Let's try to get them regular writing opportunities, or let's try to push them to get them to go speak somewhere. So that all kind of fell a little to the wayside. So I think it's bringing up, reemerging that a little bit and setting the goals. And kind of taking a little bite each time as much as we can. So now that things will hopefully begin to normalize a little bit, it would be kind of going back to those initial goals and internal goals that you have, to get a New York Times front page cover, non-COVID, make that a goal and kind of try to take that and go with it.
Yeah, I would definitely echo the goal setting thing. And yes, this blew us all a little bit off course. Things are happening a little bit later in the calendar because we've had to shove a lot aside to focus on what was right in front of our face. But yes, goal setting we just went through as a team and as a media relations team, but then in our wider unit, that's the key. But I guess the risk that all of that is. Patience and forbearance. I'm fortunate, that our bosses have been very, grateful that we kind of made it through a truly unprecedented season of change. We've still been able to roll with the punch as PR is so adept doing, and have done a really good job. So at hitting all the targets that we set in goal setting the previous year. But yeah, getting back at that and trying to be realistic, but also tempering that understanding with a knowledge that there are many unknowns for sure.
I wanted to jump off what Jenny said a little bit, where you can kind of make anything COVID. And I echo this, that I've had my hand slapped by reporters a few times when we've tried to make non-COVID stuff COVID. And I've even had to question a few reporters' asks when they were taking a paper that had nothing to do with COVID and they were trying to spin it into this COVID story. So I think it's just be careful with that. We did some papers and we said how this could help COVID patients. They said, yes, but they weren't COVID patients in the research, so that's not appropriate and you're misleading. So, see you later. So it was definitely lesson learned coming from this, that as much as you're trying to jump off the news cycle, be careful, because it's not always truthful. Not truthful. It's not always right at that moment, and it may not be appropriate at that moment. So I think it's just being careful with how you're posing research or papers or pitches, anything going forward.
And I think too, I think we all have, like a stockpile of stories that are, you can pitch them whenever. And it's, I've definitely, during the summer, when there was a couple weeks of slower COVID news, where I, grabbed out that list and started pitching that week. And, I got an ophthalmology story placed in the middle of COVID time. Like who does that? So reporters, like we said, especially once the vaccine starts to come out and things, hopefully, fingers crossed, start getting back to normal, we can go back to those stories that we've been saving. Let's hope so, because I think we're all tired of talking about COVID. I know.
Tired of writing COVID, news,
Yeah.
COVID, news,
Yeah.
COVID.
One other thing that I would add to that I think psychology coming to the fore, at least it is with asked of us, and thankfully we have a really deep bench of psychology, and I got to know them really well during that whole coloring book onslaught of coverage, because people were just like, oh, thank God for this, like this will be great. So it was a very easy sell, and we were just like hard to keep up with it all. But in doing that, and Matt was talking about, like, you really get to know these people when you're in the trenches with them. Well, I got to know our psychology department really, really well. And then as psychology of the morphed and changed to kids in the summer, teens are going to, like how to get them to social distance. All of those subtopics within news changed. We were able to change along with it. But we've had such prolonged fluctuation. And a lot of people are saying, oh, the mental health toll that the pandemic has taken on all of us, is starting to be like, we're starting to reckon up what that damage has been. And so we're finding a lot of great value around pitching the psychology of the pandemic, panel talks, op-eds, just straight up stories, you name it.
Yeah. One thing, that I do hope sticks around because of COVID is the Zoom interviews.
Yes.
It is so handy now, just being able to line up interviews with a Zoom link. I really do hope that continues.
One other piece of function about Zoom that's really been the kind of like comms team is that easily record the thing and ship the content over to, as long as it's okay and everybody knows. You can ship that interview over to your team, who can do it and create a blog post. So, which gives you another pitch asset. So it's really strengthened the hand of the wider comms team to do that kind of like pass the ball and help each other be better.
Great point. And on that note, it sounds like you're all sick of talking about COVID. So I'll ask a non-COVID question, kind of bouncing off of Jenny's last point about new things that are coming out of this. Like, what are the new skills you think PR pros need to have that that they didn't have before, weren't as important before, that you're looking out for when you're thinking about hiring new colleagues onto your team or giving advice to people who are looking to break into the industry?
Shooting video, hands down, number one. That's what I would be looking for. You can tell the difference between, different PR firms that, the people on their team know how to shoot video and get it to reporters quickly, and versus hospitals who don't. I would say, just even watching Chicago media, the majority, 90% of the B-roll that you're seeing all says courtesy Northwestern Medicine. It doesn't say courtesy the other hospitals. And when reporters know that you can give them what they can't get, they're more open to coming to you for those big stories.
I think there's something to be said, take away the technical side of, and this may be hard in a job interview or hiring someone on the team, but of patience and dealing with stress. I have an image of a colleague of mine. She had cell phone in one ear, desk phone in the other, and she was typing an email to another, all three separate accounts. And that's just something that comes with being in this field or journalism or a related field and being able to handle that. So anyone coming on in this world, I think it's just, how do you juggle, prioritize? We kind of try to evaluate, we know some news outlets run us through the ringer at times, and the energy putting in is not worth the product coming out. And of course, we would never say no to anything, but it's just juggling that and understanding else what you have. So I think the COVID crisis and everything else just kind of level set and reset that within you and with your colleagues and anyone else that may join the team down the line.
Yeah, I would echo both of what they just said, but add to the degree that science has really come to the fore in the pandemic. And I am in hopes, I'm also in hopes that the Zoom meeting continues because it's really convenient. But I hope that the elevated interest in science persists. Science light in consumer media has really changed, and I hope that science has really been relied upon to give the world the answer to the problem that's bedeviling it. So I hope that remains elevated. So for me, and I very eager to recruit the person to my media relations team. Some that are you're understaffed as a byproduct of budget cuts, et cetera. But as I think about who I might want to recruit to my media relations team, it would be someone who knows the other parts of the comms spectrum. Video is one thing. Who thinks in terms of what content can we create and how can we be thinking about the other arms of the communications team such that we can be successful, not just being adept at social media yourself. But I would also be looking for someone who really wants to get to understanding science, because I think you have to get it right, and you can't play fast and loose with science. And I think that has really been driven home to me just by the degree of specificity that I see the infectious diseases world.
I think jumping off Marvin, I think in a comment was kind of, what sources do you see for journalists? I think sometimes us PR people, you get so in your head. The pitch is snazzy headline and it's, the world's greatest thing. And I think there was something to be said with COVID that we all had to streamline. There was so much happening for the journalist perspective, from the doctor's perspective, from our perspective, getting incoming calls and emails and texts, that it's boom, boom, boom. Here's what we got. Here's our time. Here's our doctor. This is what we can say and move on from there. So I would hope gone are the days. Of course, I love a good pitch and snazzy punny headline in the subject line. But, gone are the days of that, and really just streamline the who, what, where, when, how, why, and go from there. So I think it jumps off a comment too, is kind of what are journalists looking for? What kind of sources? And I think it's when I was able to put, here's the B-roll, here's the link, here's the time, here's the link, and just lay it all out. I've gotten many, oh my gosh, thank you for this. This was just so easy to digest and understand. And you've helped me more than you know, kind of thing. So.
Great. And just piggybacking off that last comment that we got, and again, anyone can send them in using hashtag Muck Rack Live. What are the trends you're seeing in terms of what journalists are looking for?
I would say women. They're looking for women as experts to speak to. And also, COVID's having a really bad effect on communities of color. So having physicians who can, speak to the African-American community, who can speak to the Hispanic community. We're lucky enough to have several physicians who can speak Spanish for different outlets, and even having the patients. Like our first COVID lung transplant, she was bilingual. She could speak Spanish and English, and just giving a face, for that community to show them this is how serious it is, I think is also really important.
Yeah, authenticity and candor. I would just add to that, authenticity and candor. And yes, they're definitely looking for more women in science too, and that's definitely a sub thread of our pitching.
Yep.
Great. And any other closing thoughts? We're just a few seconds from the end here, but final thoughts you want to leave the audience with?
Oh, gosh. I mean, just the biggest takeaways from us is you have to think outside the box. Like the traditional ways of media relations, I think it's gone.
Yeah.
I think COVID has just changed our industry significantly, and you need to jump on the wagon because we are rolling in a totally different direction. And so you need to heighten your skills. If you never shot video before, learn. If you're not on social media, not on Twitter, like you just
Get on there.
And there are people in your department who are more than willing to help. And if they aren't, give me a call, shoot me a tweet. I'm more than happy to help. So, but the industry is changing for us. So
yeah, back to the streamline thing. I think you're absolutely right. People are just carving it up and getting it done. And that's both the reporters or everything is accelerated. And there's less and less room for the kind of like old, I don't know, it's like everything's been synthesized. It's like there's much more to, but that allows you to just like cut past all the kind of like pretense and just get right down to the nitty gritty. And I find that refreshing.
Yeah. I think also just one point is let's give ourselves a little bit of a break too. Like I said, I know you're your own worst enemy at times, and I know I'd bum myself out and say, I don't understand why no one's picking this up. Like, this is amazing. This is great. No one had this yet. No one had this point of view yet. And from other colleagues and stuff, and they just add, no one's answering, no one's responding, no one's picking up. So give yourself a break, and at the right time, at the right moment, a story will pick up and something will come through. We have an old saying, an old colleague, an old mentor of mine used to say, just a few things. We just need a few things, and then we can go to the next thing. So I think just trying to prop yourself up and give credit where credit is due, and look back at all the great hits and successes that you've had, and kind of go from there.
Great. Well, we're at time. This has been amazing. I've learned a ton. Marvin, Jenny, Matthew, thanks for coming on and sharing so much. I know you're all very busy, so I appreciate the time.
Thank you
So much.
Great. And thanks everybody for tuning in. See you next time.